Hello, I'm Janetta Webb. I'm a pelvic floor physiotherapist at Jean Hales. Today I'm going to talk to you about some hints for seeing women who have described dyspareunia. The reason I thought this would be a good idea is that quite often GPs will say to me, well, how do I manage dyspareunia, or what are the factors that can contribute to it that would maybe indicate that physiotherapy is needed. So I think probably the most important thing to say is that any sort of vaginal examination, muscle palpation, examination with a speculum, taking a pap smear, or even a transvaginal ultrasound, none of those examinations should actually cause vaginal pain. So if they do, I think it's important to investigate why, because there could be an issue with what's often termed vaginismus, so overactive pelvic floor muscles. And if this is an ongoing issue for a woman, it's not going to be relieved without some treatment. So I think that's the first thing. If there is discomfort, perhaps ask some questions to find out why. In my experience of working a lot with women who do have overactive pelvic floor muscles, dyspareunia and vaginismus very commonly develops in women who've had recurrent vaginal infections, recurrent thrush, bacterial vaginosis, recurrent UTIs. And I always encourage women to come back to you, the GPs, to have a re-swab or another MSU just to check that any of these infections have cleared up, because otherwise it's going to be very difficult to treat the dyspareunia. Also, if a woman presents with an ongoing issue of vaginal or vulval itching, remember that it could possibly be a symptom of pudendal neuropathy rather than ongoing issues with candida. Of course, it could also be skin conditions, but it certainly could be a symptom of pelvic floor overactivity or pudendal nerve issues. It's really important to use models and diagrams and explanations so that women have a clear understanding of vulval and internal pelvic anatomy. I think even with education about muscles, the idea of, okay, well, your pelvic floor muscles are overactive, what you've really got to try and do when you're having sex is just to try to relax and then everything will be okay, or use a little bit more lubricant and everything should be fine. For some women, certainly that is helpful, but for the majority of women, it's not necessarily going to be enough to retrain their pelvic floor muscles. So in this situation, they may certainly need referral to a gynecologist or to a physiotherapist if you feel that there is some overactivity. Sometimes I will speak to GPs about using topical oestrogen or prescribing topical oestrogen for a woman who is breastfeeding or a perimenopausal woman to assist with vaginal dryness and to assist then in the treatment of her pelvic floor muscles. So I guess it's really important that if you're seeing a woman who is perimenopausal and she's coming to see you for some menopausal symptoms, don't forget to ask how are things in terms of vaginal dryness, any dyspareunia, and then you can go on and manage that accordingly. Thanks for listening.